right, exactly noon. Hello, everyone. Welcome to New England HIMSS webinar series presented by premier sponsor Curate Partners. Today's webinar, AI Accelerators in Healthcare, Fueling Smart, Fast, and Scalable Digital Transformation, will be presented by Jim Bartro and Fallon Boegemann. A couple housekeeping items for today's webinar. A survey will be sent out to the group following today's webinar. Included in the survey is a section where you can use that to ask any questions that didn't get answered during the session, or maybe you think about something after the webinar concludes. You can add any questions you have into that survey. Also, an email following this webinar will be sent out for instructions on how to claim your CPHIMS credits. We will also post a recording of today's webinar to our New England HIMSS YouTube channel, and then we'll post the link to the video on all of our socials, mainly LinkedIn. Lastly, you can use the chat section on the webinar screen. It's down at the bottom to give presenters real-time responses during their presentation. They're going to ask you guys some questions throughout. It's thumbs up, thumbs down, things like that. And then you can use the Q&A section down at the bottom of your webinar screen to ask any formal questions for the presenters. They'll answer them at the end of the webinar. With that all out of the way, let me introduce Jim Bartro.
Hey, everybody. Thanks so much for the introduction, and thank you all for your time today. Just as a reminder, if we do ask for that participation, we'll try to make the emojis. I was just looking at the emoji list. We'll try to make it the ones that are kind of towards the top of the stack, so you're not searching for emojis the whole time. And then on the question and answer piece, if we don't get to Q&A during the time allotted today, we do very much want to still get to them. So don't be shy to throw questions in there. And, we're going to take that list afterwards. And for anybody who kind of opted in with contact info, we'll probably do some post-meeting outreach. So we do want, participation, even if we're kind of jamming through some stuff here. So I am new to Zoom too. I don't use Zoom very often, so you'll have to bear with me as we kind of play with it today. But so I come to this group here today from Curate Partners. I am a product manager by trade. I lead our product practice there. Our firm is unique. We work in both kind of specialized talent solutions and in kind of end-to-end, project delivery in a consulting fashion. With healthcare companies, right? That's where one of the places where we have specialized as a firm is working in the healthcare and health tech sectors. We have, work that happens in kind of strategy, execution, specialized talent, but also getting more and more into AI and automation. And that's what we're going to talk about today. We are working with clients as practitioners. And I think that's what's unique about today's presentation is and frankly, it was fun for me, I know, to put this together because it forced me into my practice of product management and product delivery to think a little bit about, what AI accelerators I'm already using, which ones I maybe wasn't using enough that in prep for today, I went off and researched and started to pull in, and also to evaluate, like, how's that going, And so we're going to talk about some of those lessons learned. But again, the focus of today will be people who are building product in the health tech space. Here are some things that we're finding help or hurt, and some lessons learned that hopefully you can walk out of today, able to go employ in your own ecosystem. At the very end, by the way, we're going to kind of zoom back out and talk about the healthcare kind of macro ecosystem and where we're seeing AI play, the legality of that and such. But we're going to spend most of our time talking as practitioners. I'd like to introduce Fallon. Fallon.
Hey everybody, Fallon Boegemann, also a newbie to Zoom, so I'll be going on and off mute during the conversation, but I am one of the CX leads, everything design and experience at Curate Partners, and I use AI, especially when I'm doing some ideation. You hear all the time, oh, we'll worry about that later with the pixels, the pretty pictures. It is more than just pictures and screens that people are interacting with. You really do need to understand who your users are, and AI is a great tool to help to ideate or get a jump off point for those things.
That's great. All right. So the folks here on the phone, here's the first kind of test of our conferencing technology and our ability to kind of use it in real time. But I have a hypothesis I want to test here. I want people who are today, I always paint the spectrum with clients about like, where are you in this adoption of AI spectrum? And I'll paint two ends of it. I think on one side are people who are more or less, feeling like AI is becoming a native part of their ecosystem. And that means you're using it as a job aid in your function. So you're using it to go faster, go farther. And that's going to be a theme we talk about a lot today. It's not so much replacement of people, but allowing people we have to go faster, go farther. If you're on that side of the spectrum where it's either there or it's customer facing for you already, you've already started to build applications where it is, your patients, your providers, your payers, whoever they may be in the ecosystem, they're interfacing with AI through you. If you're one of those folks on that side, throw a thumbs up emoji into the webinar chat. And conversely, I'll throw the other side out. If folks are on the opposite end of that spectrum where they're hearing a lot about it and they're not necessarily seeing it come up in their organization, they don't have a client base or leadership base that's super supportive of it or is pushing it. If you're on that side of the spectrum, throw a smiley face in the chat here. I'm starting to see some response come through. So if you're on the left side of that, where you're not really using it yet, you're hearing a lot about it, maybe you're getting kind of anxious. Some people are seeing chat disabled. So, okay. So if that's the case, maybe it's not universally rolled out for everybody. What I'll tell you is the clients that I'm working with out in the industry right now fall all over that spectrum. I've got people I talk to at some pretty highly respected organizations who you would think are on the cutting edge of this, who say, I'm not allowed to do anything. We have Copilot turned off. We're not using any of these techs. I talk to people on the other end who are building, health tech startups who are essentially banking on the promise of AI to deliver their investor hypothesis. And I see chat is now enabled for everyone. So I'll still ask people to throw that in. Thumbs up for, I'm using it a lot. Smiley face for I'm still struggling to kind of figure out where the starting off point is. And then I talk to organizations that sit in the middle where, oftentimes that story is, we started to do a bunch of stuff. We got some POCs out there. And then for some reason or another, oftentimes like the CIO stepped up and said, hey, this is getting out of hand. There's a bunch of reasons why, but people pulled back in 2025 from where they were going, and they're now reevaluating. I think that's a common place too, but wherever you're coming at this from, I don't want you to feel like you're alone. There isn't like a silver bullet answer that we're seeing for, this organization is using it all, using it right, doing it right, figured it all out. This is dynamic. And to prove that, I'll tell you, Fallon and I started putting this material together a couple months ago. I mean, like 8 weeks ago, I think is when we started collecting material. We've redone this slide deck multiple times, like not because we weren't prepared, but because the state of the art has literally been changing that fast. And I'm seeing like a smattering of both reactions here in the chat. So I think you're all coming at this from the similar places where there isn't like a central groove yet. We're all kind of figuring it out. Hypothesis time. Like what is our overarching kind of way in which we're positioning AI, with a lot of our clients? We are thinking of this as a tool to help you go faster, help you go farther. I said this before, but, if there are, routine tasks that, for instance, if you are, and we're going to go through a bunch of, specific examples later, but there's a lot in the healthcare system that, they've been botifying things for years, right? I've worked with service organizations who built really elaborate bot logic. Doing that now with AI tools takes a fraction of the time it took to program bots just, a year ago. Like routine task automation all the time. Shortening response cycles, shortening the cycle to, go from thought to written word and direction. These are all really apt things for the AI tools that we see being commonplace in the ecosystem today. Critical tasks that we have human brains involved in. For instance, clinical decision making. Not only is that not something we'd recommend, it's in some cases not legal yet. So like I guess that's the ultimate theme here is I don't when a client says, "Hey, we want to get rid of 10 people, so what's the AI tool we need to bring in?" It's like, I'd love to consult with you on that, but I want you to think about the problem a little bit differently. I want you to think about how much more can you get done with those people you have, those 10 people, with these tools bolted on them. So, Fallon, anything you'd add to that?
Yeah, especially when folks are saying, I want to replace a human with an AI bot. Really just think of AI as another computer or another super engine that's going to save you time, especially when you're trying to sort through a bunch of decks or ramping up for information. It is great at, like I said, that jump off point, that summarization, but it is not a replacement of me, myself as a designer, or anybody else on the teams.
Yeah. Yeah, well said. Um, there's some logos here on the slide. It's not logos, but some names of different products and applications here on the slide. And the reality is that there are now an ecosystem of tools and capabilities coming to be that kind of live across the product development lifecycle. We at one point, not too long ago, and this is what I said, we've had to redo this a few times. When we were talking about, for instance, in product management, where are we using it? We were talking about LLM-based, ChatGPT, kind of like we're writing better epics and stories. And we'll still talk about that. But there are prototyping applications out there now that are super powerful. These, capabilities are starting to find their way into the applications that we use and love every day, right? And we'll also talk about like where that's working and maybe where it hasn't been great. But I'll tell you, every organization that I work with right now that is AI enabled, in other words, they're past that stage on that spectrum where like they've figured out that this is something they have to do. They are desperately looking for where can they, there's always some investment hypothesis tied up in that, right? That could be on the startup side. That's where the equity came in, right? Is because they had a good AI story. In large enterprises, it usually does have to do with cost or speed. But like I'm seeing in the places that are AI enabled, we're starting to see a proliferation, and that is, the same in our product development lifecycle. Fallon, anything you'd add to that?
Yeah. So in the workflow, we do, like we said, have a couple different AI-based tools, and it is not us saying you need to have every single one of these tools to be successful across your product lifecycle. We're really just showing examples of different tools that specialize or they go really, really deep into these workflows. But for the most part, you can get an initial jump-off point or some sort of first draft from even just ChatGPT, from the free versions. The idea here is to help you and not hinder your workflows. So we're not saying you need to add 12 new things, learn a bunch of systems. You can use what you have to your advantage.
Yeah. Yeah. Well said. And I think that's a key theme too, is that jumping off point. Like that's where I'm personally getting the most use for these tools in my professional life right now is, as a product manager, so say I'm working with a nursing team or I'm working with a revenue cycle team on an idea for an application. The cycle time to go from a conversation to something that we can say we understand each other or we don't is a fraction of what it was a year ago using some of these tools and applications. And we'll talk about some, shovel-ready options for doing that. Overarching themes that you'll hear a lot today, right? I think is, the practice that Fallon and I are employed in right now is really focused on, how do I get accelerated time to market? These are the KPIs that I'm essentially talking to clients about when we talk about an AI-enabled accelerator or a project, right? We're talking about enhanced efficiency and cost reduction, right? These are the major motivators people talk about. But increased innovation and creativity is one that, some people, when you first say it, they shy away. They say, "Whoa, hold on. Humans are the magic here. I don't know if I want the AI being the creative engine." And that's not what we're saying. We're not saying it is. The ecosystem that is becoming possible with it allows us to spend more time being innovative and creative and less time writing, typing in Jira, less time, dragging objects around in a design screen. more time talking to our users, more time talking to our clients. And then finally, data-driven insights and user-centric design. So, we'll talk more about some of these things, but like this 4 box right here is really the areas where we see it impacting today. So we're going to talk about our design practice first. So this will be kind of broken up into 2 sections. We'll have our design practice lead, Fallon, here go through some of these use cases, and then we'll actually go through some prompt examples and the kind of good stuff and the gotchas that are associated with that. We'll probably pause there, do a quick, any, questions that are imminent, we'll stop there. If we see a lot of activity there, we might have to drive on and circle back later. We'll stop briefly there. Then we'll talk about product management and product delivery, and we'll go through a similar exercise. So Fallon, why don't you lead the next few slides?
Awesome. So in my world as a designer or in the experience, just trying to get acquainted either with products or with the healthcare system, we all know it is incredibly complicated and it is a lot to take in. So where I use AI tools the most is in order to take all of that massive amount of information and structure it for myself, for my team, in a way that's easily understood so I can start to see patterns. That's where my creativity comes in as the human. But that initial download, being able to summarize, user sentiments, surveys, a lot of information, either from different tools, from different social medias, being able to gather all of that would take me probably up to a month just to ramp up into a new product. So I use the use cases, user research and analysis in order to cut down that preparation time, not even in half, probably by 80%, just to understand the audience, their needs, behaviors, and preferences. So that'll be the first use case that we go through. With interaction design, really just that jump off point, that initial validation of, hey, I have a user flow in my head, or we know the customer journey. I need to start to highlight some different areas of that for either gaps in the experience where patients are not understanding their claims. What are those highlights and where are we starting to make assumptions? So those large data sets of information that we have, whether it's user engagement data, different heat maps, things like that, online and offline touch points, being able to highlight them and put them all together in order to define those KPIs has been where in interaction design, just seeing that macro and micro level interactions has been much, much quicker. And then the final use case I'll go through is once a design is completed, we're starting to look at it with users. Of course, there's a lot of transcripts, a lot of great insights that happen when we're working with users. And in order to evaluate all of that information, you can feed that into an engine and start to gain insights or see those patterns really quickly, again, reducing your effort by 80%. Something that would typically take over a week of time could be done in a couple hours. Right, and then for the next slide, we'll go into the prompts. So for each of those, for user research and analysis, like I said, the objective is really just to gain empathy for the users at a high level, and then start to find out where we need to drill down. So going off of that jumping off point, you won't understand everything at a given point just because you put it into an AI engine. The outputs are really only going to be as strong as the inputs. So when we're talking about putting in for user research and analysis, you can start to get some user personas, but then you'll want to always review your work with your marketing teams, with your partners to make sure that they're accurate. Because if you don't layer in any sort of, exclude this or validations in hand, what comes out from the AI engine is just going to be at the broad level. It might not be as specific as you need for your given audience. So only when you upload your data set and putting in all this information in that prompt, I promise I will not play karaoke with you all. But the idea of the prompt is so that you'll know who your primary audience is. You'll know who your company is or the user goals. If you input that information, what comes out from the engine will give you discussion points that you can then bring to your team. But everything that comes out, please do your manual due diligence to validate that your data that you're putting in is not only accurate, but it excludes bias. So say you had a user study that only had very rich inner city type of patients, but your project is actually focused on rural demographics. That's having some bias in there. You're getting information that was not with the audience that your product is trying to solve for. So you've inserted bias by excluding the users that maybe you're trying to influence. And some follow-up prompts. So just because you're getting that high-level user persona or understanding of the user goals, being able to generate a list of gaps. So anything that may have been missing. It's also a really great way to validate your data. So if the engine is actually starting to make assumptions for you, you can talk back to the engine and say, hey, where did you make some assumptions? Please highlight them for me. And then in order to validate your information, you can even ask that last questions, my personal favorite, generate some user research questions that will validate what the output was as correct. So you can go back and refine your work.
That trick, by the way, is applicable to many different, conversations that we have with these agents about, help me to generate the test case to validate that this user story is, and again, that takes minutes and hours out of your life if you start to get into that habit. I see a lot of rich conversations in these conversational AI applications. Those are what are yielding the best outputs.
Yes.
Great.
Awesome.
Right.
For our next use case, interaction design. So interaction design can be everything from where a user may be tapping on their phone or interacting with their desktop screen. But if you think of interaction design actually as the broader picture, that overall journey map or experience both offline and online, you can work with, in this case, every use case that I have is for a chat-based engine, because it's the free version that most people are familiar with. But you can start at that macro level, that high level journey, and then go more specific into user flows, and whether it's you're feeding your user flow in and just asking for where those gaps may be, or you're asking for an initial user flow or map, you can then start to see where the gaps are yourself. And that's where, as human and AI tools start to interact, it's that checks and balances in there. So for the prompting in here, act as a UX designer. I don't have to tell the engine anything more about my role or what my expectations are, but say at my job, it's very specific, what we include in the user map. So I want to be able to inform the engine as much as possible up front. So I've put in a lot of different sections in the middle of the screen. You'll see include the following sections. You can tweak this, you can update it based on your needs, or you can just take that first sentence as a UX designer, create a journey map, because all of the context is actually built in to these AI engines themselves. And then when you're doing your follow-up prompts, again, generate a user flow that illustrates XYZ. You want to start to deep dive maybe a piece of the output that was given to you. Or you want to jump off point of, I know that there's an issue at touch point 2. Suggest 3 updates to the existing touch points that address current user pain points. You've already got an output of your user pain points. So how can you make that engine start to work for you a little bit and deep dive?
And I'll say before I go to the next slide, in the Q&A, so the question and answer, not the webinar chat, the question and answer section, of your response in the Zoom window. If you want to start teeing up any questions you may have from anything you've heard from the previous few use cases or the next one, please start to do that, and we'll take a quick pause after Fallon's done with these use cases.
Perfect. And then the last one, this is probably my favorite use case and what I use the most often, because in user testing, typically, if you are in healthcare, it's the first thing that may be removed from your product lifecycle, where we'll test in production. But the idea here is to not hinder the product lifecycle, but to actually add to it. And the largest amount of time when I'm doing user testing is evaluating everything that I've heard, whether it's a moderated test or an unmoderated test. I'm trying to see very quickly some high-level results that I can then share on with my team. And in order to do that, again, being able to identify those key themes, but also give some details in the report. You can even ask it to highlight specific quotes if your team really wants that human experience or that human relation in there. But again, you're saying act as an expert UX research analyst. I have had some differences when I take out that word. So also adding in our learnings, analyze the attached collection. So again, being able to input as much information as you have, whether it's an Excel document, whether it's just a Word document of definitions, being able to input as much as you can, and then your output will be that much more relatable, or a better first draft, I should say, than just a high level idea in the sky. But when you're saying write a usability report, that usability report is predefined, or for the most part, the AI engine knows what it is, and it will actually put in that report format for you. Some highlight or some follow-up prompts is, again, highlighting quotes, listing feature requests or recommendations. So if you want to keep your evaluations very specific to what you tested on, you can even say something like exclude, anything that is not relevant to the topic, or put it at the end of your report. And then where necessary information is missing from the data set, make and clearly mark assumptions, because that is very key for evaluation or any analysis, and provide a rationale for each assumption based on the context of the availability data. So when you're saying that, you are very directly telling the engine, if you're making an assumption, tell me so that I can go back and validate it.
Mm-hmm. Great practice. I see one question in the Q&A, because I think that was your last use case for this section, right? Yes. So let's pause for just a minute. I see one from a person attending. What are some common mistakes or misconceptions people encounter when working with AI, particularly in the healthcare sector, that you would suggest avoiding? You want to start with that, Fallon? Do you have an idea?
Yes, and I think that we actually have a whole slide dedicated
Yes.
to a common mistake. But the biggest mistake that I'll see is AI is flashy, it's big. So certain folks will say, we want AI because we want to be on that train or on that bandwagon before, it leaves the station. But if you are going to go the AI route, don't forget about the foundation. And we have an example later in the deck about Figma, where in trying to expand their AI capabilities, they dropped a huge ball in terms of accessibility, which we all know is very relevant in the healthcare industry. So not only introducing some sort of legal or liability in there, but when they built their Figma sites tool, they actually, for the most part, they left off accessibility in that design or in that product. So just because you want to expand on AI, don't drop the ball on, say, legal, CMS ramifications, or other regulations that you have to keep at the foundation.
Yeah. And I'll riff on that for a minute.
Yeah.
About a month ago, we were asked by one of our clients, a large healthcare tech company, to come and do a lunch and learn about generative AI and AI use cases in the development lifecycle. And when we did that, one of the panelists said something that really resonated with me, which is that they're seeing a lot of pressure to AI at all costs. In other words, product teams and dev teams being told AI, AI, AI. It's hard to say. But what they were suggesting is like you should still be a good product manager. You should still like ask, but what is the outcome we're trying to achieve? What are the metrics we're trying to move? What's the KPI we're trying to nudge? Sometimes that's getting skipped, right? Frankly, people are in the rush to adopt because of the promise of the future. They might be skipping that ultimately like super fundamental step of developing things people love, which is to ask like, who is my user and what do they really need? So that would be my suggestion. So on that, we're going to pivot here for a few slides and talk about, so kind of in our product development lifecycle, we've got discovery and design is very front loaded, right? Like I don't like to take work onto a Scrum team that I'm running that hasn't been well researched, well discovered. And so we're going to kind of step from the idea that, you're at that phase of product management where, you've got kind of the nugget, you've got the grain of where you're headed. But you need to do some more discovery as a product manager. So the discovery Fallon talked about was discovery about, discover about your users, kind of assumes you already know the market you're playing in. I'm going to actually step back. I think in parallel to that, or even prior to that, I often tell product managers, really make sure you understand the landscape, really understand the ecosystem you're going to play in. So we're going to talk about some of that level of product discovery and using AI tools. We're going to talk about kind of the bread and butter of product owners, right? So epic and user story definition. This is the thing that oftentimes is overlooked and makes or breaks successful Scrum teams, right? Development teams. It doesn't have to be Scrum, Agile. It could be any way you're working. And it doesn't have to be epics and stories. This could be user requirements. This could be PRDs. It doesn't really matter what structure your team is operating in. But authorship is the ultimate job of the product manager / product owner. Having it so that 80% of the time, the team is able to feed themselves. They have the context. They can run really fast, and they're not having to stop every 5 minutes to ask the PM or PO for clarification. We'll talk about kind of using these tools in that place. And really the speed there that comes from that. And the efficiency, frankly. Like I will say, I am able to spread my product owners over more teams than I was a year ago because some of this burden has been removed. And then rapid prototyping and some of the things we were alluding to before about going from a thought to something tangible as fast as possible. And I'm also going to talk about the risks inherent in that too. But having internal demo ready stuff fast really shortens that cycle time of getting down a path and being on the wrong path, right? We want to find that out as soon as possible. And this is one of the great tools that we now have to do that. So product discovery, like I was working with a client who was trying to build, so they live in the rev cycle space. And they were trying to start to build a dashboard for rev cycle visibility in the FQHC space. And, I've been in healthcare a long time. This person's been in healthcare even longer. And I said, what do you know about FQHCs? And they said, we kind of both had like a tertiary understanding of, what role they serve in the, value-based care ecosystem and, where they came from. And I was like, do we really know enough? And so what we did was we partnered up on some prompt writing. We kind of peer programmed some prompts. We got on a Microsoft Teams, and we started to interact in this case with OpenAI's ChatGPT engine to start to do a research paper where we actually dug into a very broad prompt at the start, like you see there, and then follow-up prompts. And then as the research paper, we told it to structure itself as a research paper. And we ended up with about a 5-page paper. And then as you started to go through it, you could see section 2 had something to do about legal, and I could go in and say, hey, section 2, I want you to actually create a dedicated page just to section 2, right? Go actually create my own subpaper, addendum, focuses entirely on legalities, and you can do that with every section. So it's like builds on itself. As you start to read and consume what you're seeing, you can start to ask follow-up questions, ask clarifying questions, debate the thing, like you can say, like, if it challenges an assumption you have, that's a great opportunity to do what Fallon is saying and say, tell me your assumptions. Like, how did you get to that conclusion? And like I said, the best outputs here come from rich conversations with these things. I'd say, again, the research paper is super valuable. Test it. So one of the things I did was I took this research paper and I knew we had a rev cycle expert who had worked with FQHCs. And I said, hey, summarize the research paper into an email for me. And it did. It created me a nice little email. And then I actually brought that back to that expert and I said, here's a bunch of things that I think I now know about this part of the ecosystem. Can you tell me if they're right or wrong? Good news is we were like 95% of the way there. There was a couple of things that I misinterpreted or it misinterpreted in its summary. But I mean, the process that this cut off would have been weeks of me Googling, calling, scratching the internet for knowledge here, or calling friends of mine in my ecosystem, my network, to try to get this context. So it's a huge time saver. And frankly, it made this person's first jump. And I'll actually talk again about this particular use case when I talk about prototyping tools. It allowed us to very rapidly understand, hey, what is a viable thing? What is a need? What's some white space in this area? The second is the one I'm the most passionate about, right? So epic and user story definition. So what's unique about my role is, I'm I'm a leader in our organization. I, have teams, but I'm also a consultant. I go and work with teams, and I have no ego in that. There are times where I am the product owner on the Scrum team, writing the user story, and doing acceptance testing, and like that's still a part of my life. And these tools have allowed me to spread myself across more and to go faster and better with those teams than I ever could have without them. So going in and writing really good prompts about, and again, this is an example of, building a dashboard for hospital CFOs. Again, broad, right? To do this right, I couldn't make the slide. I think we thinned out the slides because these prompts can get kind of big. And that's a gotcha, by the way. You got to like make sure you've got the licensing for whatever tool you're using to have kind of high token prompts. In my case, at some clients, we use Microsoft Copilot. In others, we use ChatGPT and OpenAI tools. I have another that is starting to experiment with Claude. So I think, each of those brings its own benefits that you should go out and research. Some of them are better with unstructured data. Some of them are better with large, high token prompts. But, you go in there and you start to describe the feature set that you envision. And if nothing else, that exercise, that solitary, let me get my thoughts down into this prompt, is a step that I wish I made every product manager do since the start of my career. Because I find that alone is a great exercise to really say, do I understand how this thing is supposed to work? But one of the things these tools are great at is, one, help me think about the edge case scenarios. Once you can see it understands it and it starts to spit back to you something that is resembling of what you expect. Tell me about edge cases. I learn about edge cases that I had not thought of that would have come up, right? These are things that, like, once we got this thing to production, I would have learned about those edge cases pretty fast. Or late in the game, I would have learned about them. It's great at that, right? Thinking about metrics and how am I going to measure success? It's great about that. And again, think about the process of doing it yourself, of having to ideate this stuff, structuring the thing, getting it so that you can get it into Jira or Rally or, Smartsheets or whatever you're using to manage requirements, Word docs, whatever you are. You're taking hours out of the equation. Show me your data sources, right? Here, let me give you some data sources. Let me upload a document and learn from it. You got to watch these things now sometimes. Sometimes, then different ones is where I said some of them are better than others. But depending on your tool set, as long as it's kind of doing its due diligence and reading the materials, I always suggest bite-sized content to the extent that is reasonable for this use case. I like to write multi-step prompts where I say, here, I'm going to give you 3 prompts. And I tell it up front. Prompt 1 is going to be all the context about our business. Prompt 2 is going to be all the context about the use case. Prompt 3 is going to be, the archetypes and, what we think are, the white space we're trying to cover, right? And then at the end say, now with all that, write me an epic. Writes you an epic. All right, I think you got it. Suggest storification of this. Suggest how I could disaggregate this epic into work that, a development team, and I'll describe the development team, a front-end person, a back-end person, a UX designer, et cetera, could feasibly consume within 2 weeks. And it gives you a first crack that when you go into the first refinement session, requirement session, whatever you're doing with your, organization as far as development lifecycle, you are like a light year ahead of you would have been, because we've all sat there, I'm sure, in an IT project or a development project where you go in and it's kind of like a couple bullet points. And then you're spending the precious hour you have with that dev team, especially if they're offshore and you're mixing hours. You're spending a lot of time clarifying and answering questions. In this world, we want to be having those questions and those answers be about stuff on the screen, about specific use cases, about specific direction. And I think you'll find a much better use of your collective time. And then this is the newest one to me. This is the one that I had to rewrite as I was going here because I heard about these prototyping tools. Things like Lovable is one that I've been using a lot. But I hadn't really used them until about a month ago. And I've started to bring them into both my personal, projects I'm working on and where I'm consulting from a strategy perspective and working with clients who are saying, "Yeah, I have this idea. I don't know how to convey it." It's like, all right, well, sign up for this, and going from an idea, a concept, to something that is actually working and when I say working, these tools produce two things. They produce nice clickable workflows, for example. I was talking to a client the other day who was in that FQHC space. They were trying to build essentially the dashboard that the CFO at this organization they're talking to would use. And I mean, it was a rich conversation. When you look at the prompt history of it, I mean, it was a conversation. This person had to work at it for a couple hours, but they had it wasn't a design. What it wasn't was visually appealing. It wasn't well researched, right? It was very much based on this person's own bias and their own assumptions. But what it was something that they could sit down with me or an engineer or an architect and start to have an order of magnitude conversation. For instance, I have envisioned this experience. Where would you get the data to do step 2 in this workflow? Oh, good question. Is that right in and of itself possible? These are conversations that the farther left we have them in the development life cycle, the better we are, right? The last thing you want to do is go and show a senior leader, an executive, or God forbid, a client, something that looks awesome or really kind of scratches the itch that they've conveyed to you, and then find out right afterwards, like, oh no, like this is kind of hard to build. This is going to take a year when I said it was going to take 6 months. So, having those conversations, and that's what this facilitates, bringing that farther left. The other output of these things are in some cases working product, working code. In the Lovable case, you can go to the developer view and it will actually show you the React code or whatever it's building for what it is, demoing you in its runtime environment. Now, would I recommend you take that and adopt it and build a product off it? No. And this is one of the warnings I have in the industry right now. That is a great, as we were talking through some use cases with someone the other day, I was looking at that view and I was like, all right, it's kind of suggesting a database structure here that doesn't exist, but like seems logical. But like, it's just like, this is a suggestion, guys, like don't run with this as gospel. Don't say that is, and I'm sure there is going to be a proliferation. Anyone out here who's afraid of, if you're in the technology space and you're like, geez, my job, I'm worried about it right now. Where's it going to go in a few years? I can tell you one area, which is going to be, there's going to be this massive proliferation of products using these vibe coding, low code, no code applications that there's going to be a lot of work to be done to kind of untangle, right? Because the barrier to getting something to exist is dramatically lower. That's great. It's going to increase access to great ideas out to the world. It's also going to, lower the threshold for access to bad ideas, right? So with that comes opportunity, everybody. We'll have a chance to unravel these things and make them better. So let's step back for a minute and let's do a quick, before we go to this slide, let's do a quick Q&A. Are there any questions that anybody has before we kind of get to the next set of content where we're going to zoom back out and look at the macro industry view? And put them in the Q&A section. And for time's sake, what I might do is drive on. If you have questions related to those 3 use cases or other things you've heard me say in this part of the presentation, put them there, and I'll try to find a logical spot in here to stop and pause and read them if I see them, okay? Actually, I see one from one of our members. I'm hoping you can cover the apprehensive attitudes regarding AI, specifically when dealing with PHI and sensitive proprietary data. Additionally, are there any programs that HIMSS endorses and certifies that may boost confidence for orgs? I can't speak to the HIMSS piece, but I will research it and I'll talk to the New England HIMSS folks about that. So what I would say on that is, if you want to reach out to me after this, just get me your email. I will research that and I'll get back to you. On the first piece, on the apprehensive attitudes towards AI, we'll split that into 2 pieces. The PHI and sensitivity I'll put towards legal, and we're going to talk about some of that in a few minutes. The general apprehensive attitude, look, people rolled hard on some of these things, and executives, and I mean anybody who's gone to an earnings call for a large public company has heard the savings, the cost savings. Look, that is not a confidence-inducing set of statements to your workforce to go out and say, we're going to reduce 20% of our headcount because we have all these tools. I also do not believe it. It is not, it's not realistic. Now, it doesn't mean they might not try, but I think the biggest advice I have for you as leaders is that, and I mean that as if you run an organization or if you're a thought leader in your organization, which I'm pretty sure you are because you're even participating in this, is to go in and to take the tone we have tried to hear and look for the opportunities. Bring those opportunities back to your organization. I try to be a person who converts mindsets on this, because I will tell you, I was originally on the other side of it. You know, as I started to see these things a year and a half ago, I was fearful. I had my moment of doubt. And now as I've started to play with them myself and seeing what they can provide, you know, I am a convert and I'm trying to make more. So I would say be a change agent. It is not something you can avoid or hide from. Maybe temporarily, you know, due to legal restrictions and whatnot. Again, we'll talk about that in a minute. But you know, embrace the change because it's coming. Fallon, anything you'd add to that?
Yeah, I'm actually really glad that we're looking at this slide while getting that question, because a lot of folks will say, oh my gosh, like if you have a prototyping tool, what do you need Fallon or other designers for? That last bullet on the last bullet on the very last column, treat the prototype as a communication tool. It is so much easier to look at something as adult humans. We're all visual creatures for the most part. It's a lot easier to look at something and see what's wrong, what's missing, and react to it and communicate with your team versus looking at, you know, a 5-page output just of text. So use these tools as communication tools, as starting points. They are not final, and they will never be final or a replacement of a human. It's just giving yourself another tool in your toolbox to make yourself more efficient.
Yeah, great. So with that, I'm going to go to the next. So we're going to zoom back out. We're going to talk about, you know, the AI across the healthcare ecosystem. We're going to talk about now, we do work with a lot of clients and, you know, who have, you know, various interests in the healthcare system. We work with provider organizations, we work with payer organizations, people who sit in between. A lot of what we're going to talk about here really are things that I think any of you would see if you went to the HIMSS show, if you went to a HIMSS event and walked the you know, the booth floor in June, if you went to Vive, if you went to Athena's Thrive show, if you went to any of those sorts of shows last year or next year, you're going to see things like this, right? So this isn't, you know, stuff that necessarily we are working with our clients on today, but there are more things that we're observing as we go out and interact in the industry. So the first one is what I'm passionate about, right? So care managers and case managers. I've worked with care and case managers in multiple different engagements over the years. And, you know, I talked to a patient one time who told me the care manager from a payer, no less, was the only person in the whole healthcare ecosystem who cares about me. That's a sad statement, right? But like, it was this person who was who was really in the central place in their care journey, who was trying to like pull together all the various components, and they were a human on the phone, right? Or they were a human in person, and they have some clinical background, and they're like trying to help this person navigate a really difficult time in their life. And these products are now starting to be built to, you know, and this, there's one in particular out there I just saw at the, we were at Athena's Thrive show last fall, where they were starting to do, you know, case note reviews and starting to create kind of bulletized case prep, right? Where you can go off and a care manager, in the 5 minutes they have before they get on the phone or before they walk in the door, they're on their iPad, they can see, here are the 5 most relevant things I can talk to this person about. You know, we've used this practice in kind of provider facing ecosystems, you know, in the EMR, and they're starting to kind of come down license, right? So you're having a nurse or whoever that person is in that case, or care management role, start to have a much more efficient use of their time, because that's the thing that kills these processes is inefficiency. Another use case, again, in the kind of care management, but more in the care navigation, self-guided care navigation. So we've seen care navigation products before that use various levels of intelligence to, essentially present a static decision tree. Now, oftentimes, to the question about clinical efficacy, sometimes this is dictated by the organization's risk tolerance. Sometimes it's dictated by CMS rules. But there was always this kind of like tree-like approach to care navigation. And frankly, anybody who's ever built a workflow knows the more of those decision points you put in front of the person, every fork is an opportunity for them to fall out, right? Every time you fork them is a chance where they can say, I'm just going to the ER. And that's the don't want to have happen situation. So, there are products now being brought to market. I especially see it with payers. I hear it from payers in earnings calls, where they are starting to analyze the totality of the information they have, which is frankly all the information. Like payers are the central hub of this information to try to really fast track the care navigation process. Really get that person, instead of sending them through the whole tree, get them as far into that tree as possible as the starting point, knowing because of SDOH concerns, you don't have to ask them these questions. Knowing geographically where they are, you don't have to ask them these questions. It's always important to have safe off ramps, like hey, if you're having chest pains, you should go to the ER right now. That doesn't go away. But I think we're starting to see the conversational nature of these interactions are really starting to show their value. And the macro trend we're seeing is people are going away from kind of search type engagements. They're not interested in navigating through your website as much. They're not interested in going through their search results as much. They want to ask the question and get an answer, right? And that's starting to see benefits in the care nav space. In RCM optimization, where I do spend a lot of time, I'm seeing a lot of work go into reinforcement learning, where they're starting to take the lessons of these huge service organizations. Some of you may, if you're in the RCM space, may be familiar with these. We oftentimes outsource and offshore these operations, and they build bots, and they do a lot of manual, repetitive tasks. And you get people, humans, sometimes who need to be in the mix. You're feeding them work lists, and the goal is always feed them the right work list. Well, you can start to use these tools to hone down those work lists, A, so that the right work's getting through the filter, but B, the right person is getting the right work and they're getting it in context, right? They're not just saying, here's a blocked claim, go unblock it. They're saying, here's a blocked claim, there's been 3 more like it today. Here's what unlocked the first 2. Here's what seems similar with this one. All of that is shortening the cycle time. Some common challenges, and we're going to kind of split this up. I'm going to take a crack at it, and then I want Fallon's kind of point of view on this. So, look, bias is the ultimate, enemy of good product, right? And knowing your bias as early in the process as possible. That's knowing your bias as a designer, a developer, a product manager, knowing the bias of your research, knowing the bias of your business case. Because frankly, sometimes they're biased, like understanding that these tools can magnify that if you're not, really careful. I'd say on legal limitations, I have one slide after this that'll talk about some federal and state government movements of recent, to start to put the hard and fast you shall and you shall nots around this stuff. The ultimate theme is human in the mix for big, important decisions, right? And that's a theme that I don't see going away anytime soon. Fallon, what would you add on the other 2 boxes?
So we talked about, with the bias, we talked about Figma sites and how if you focus too much on the big, bold, beautiful, expanding AI and being, the best of the best, you can't, fall by the wayside the foundational components. You can't leave out those critical questions that product managers will ask, or even designers and web accessibility experts will ask of, have you made this consideration? Use the materials or the outputs with AI as that starting point to then, dissect it further. When we're talking about bias, of course, there's bias everywhere, especially when we're doing any sort of user research or on the reverse end, the user testing, but making sure all the time that you have diverse representative data, whether it be, screeners for making sure that you have the right types of users that you are working with, defining what ethics or HIPAA regulations are upfront. If you are working with PHI in your designs, there are tools that can see certain parts of the screen, but then they block out those PHI pieces. So you're still, from a legal perspective, not going down the wrong path. But when we're talking about legal limitations from the design perspective, at least for my area of expertise, it's that accessibility or making sure that you are having designs that can be interacted with. So usability and accessibility, you can even use these engines as a, hey, what types of, write me a checklist for reviewing accessibility, or write me a checklist for WCAG 2.1 standards and where I'm falling flat. So you can inform, but also making sure that you have those humans with the expertise to validate any outcomes.
On the legal side of that, just to double click on that one box. So there's some federal rules, right? CMS has started to kind of issue some guidance, some official guidance. The overarching hypothesis here, from the government, it looks at both state and federal levels, remains for clinical decisions, we want a doctor or a clinician involved, right? Now, where AI can be really impactful is in putting more decisions in context. The same, I was saying before about the RCM example, if you're doing prior auths, for example, using AI to put the prior auth in front of the right specialist, at the payer's hands, put the context of the case, the totality of the case in front of them, summarize, contextualize the response from the issuing provider, and shorten the cycle time of a human being able to do that and be thus able to do more in a shorter or the same amount of time. So, that is going to be a theme like that. I don't see that going away, right? I do see the expectation of speed, because these tools really do, accelerate things. I see that not going anywhere, but I also see, a human in the mix for important decisions as a theme that for years to come, I believe will be part of this. And then, the legal limits, here's a couple examples of where that's starting to find a home in major products, right? Like I like I just gave the prior auth example, but like Epic is currently starting to build, provider facing, prior auth submission, prior auth context and documentation workflows, leveraging these tools that I think is going to help in this, critical time of physician burnout, right? We have buried our doctors and our nurses and our other, skilled clinical professionals in paperwork. And I see these tools really as an opportunity to unbury them to some extent. So from insight to action here, we're all on a journey. There's a big spectrum we painted at the start of this. You're somewhere on it. If you're on the left-hand side and you feel like you're not getting enough cycle time with this stuff yet, it's coming, all right? And you're not alone. There's a lot of people, again, at big, well-respected organizations, haven't touched this stuff yet. All right, so you're not too late to the show, but you got to keep your head on a swivel right now. Now is the time to be doing exactly what you're doing. Attending if New England HIMSS does more of this, with health tech, leaders like ourselves, go to that. Absorb all the information you can. The human touch, is essential. And, they're augmenters. This is to make you go faster, farther. It's evolving rapidly. We've had to redo this deck multiple times since we started doing it just 2 months ago. It changes every day, evaluated every day. Now's the time to experiment. Now's the time to explore. So go out and do that to the extent you can. And if you're not allowed to do it at work, do it at home. Go get yourself a ChatGPT license, and use it. I used it to book flights and plan out a trip to one of my son's sports tournaments the other day. Really, it's really fun to play with, and there are real legitimate real world use cases. Stay sharp, stay relevant, and you're not alone. We can help you. Folks like myself, like Fallon, we're out here trying to explore this stuff. There's more folks out there like us. So look for the helpers, look for the early adopters, look for the people who've already got some battle scars, and ask them lots of questions. And, don't be afraid if you need assistance because many people do right now. Okay. Fallon, anything you'd add?
Now, you summarized it perfectly.
All
And
right.
right at time, too, I will say.
Right at time. So here's the thing. If you asked a question or if you wanted to ask a question and couldn't get through, because we're right at 1 o'clock, so our contact information will be provided, and I'd be happy to, if you've got a question or anything we talked about today, please reach out. I'm going to be diligent about responding to these. So will Fallon. And furthermore, I know there was a question in one of the chat windows about, being able to get these materials. I don't think the New England HIMSS folks have these at this point, but if you saw something here and you're like, oh, I wish I had that slide, again, reach out to us. Contact information will be provided. We're happy to provide these. So any closing remarks from the New England HIMSS folks?
Yeah, of course. So thank you everyone for joining today's webinar brought to you by New England HIMSS Premier sponsor, Curate Partners. And thank you to Jim and Fallon for presenting. Again, like Jim said, be on the lookout for a survey regarding today's webinar, as well as an email with instructions on how to claim your CP HIMSS credits. We'll also be posting a recording of today's webinar on our YouTube channel, so New England HIMSS on YouTube. And we'll post that video link to all of our socials as well. And then lastly, I know Jim just touched on this as well, but if you'd like the slide deck from today's webinar, you will need to reach out to Jim directly. He will be able to provide that for you guys. And he just put in the chat.
I think I put it out I think I direct messaged it. So hold on, let me.
Yep, he'll put that in the webinar chat to everyone, his email. You can email him for access to the slide deck. So thank you everyone so much and have a great rest of your day.
Thank you all. It's great to talk to you
Thank you,
today.